Wow, they added a lot of stuff to Zoom that you can use since I last logged in here. It seems like 2 years ago we knew every feature of Zoom in and out, and there weren't this many. Howdy, everybody. Welcome aboard. It's good to see a lot of familiar faces. We'll give everybody a couple minutes to get on here. Um, but tonight, guys, we'll probably spend about 45 minutes to an hour covering general topics about this year and next year and preparing for a successful match next March or the following March in orthopedics. I'm sure a lot of you have questions about it, and we will get to questions. We're going to try to them, a little more general tonight. We are not going to talk about any one specific application, but we will set up for you to do that really soon because I know a lot of you have questions, and some of your questions may kind of lend themselves to a good general broader discussion. Okay. First and foremost, for those I don't know, I'm Tom McPartland. It's a pleasure to meet all of you. Many of you I've met at Ortho Interest Group events. You may have met some other faculty within our department. Hopefully some of you, and I know some of you have already rotated with us or shadowed in the office. But we are really looking forward to having you come through orthopedics this year and kind of bolster and enhance your experience and understanding of what I think is, the best field in medicine. But also help to affirm, what you look at as career pathway. Okay, I know that some of us spoke on career night, but really, orthopedics is a field that's just a little bit different in terms of how you go about kind of presenting yourself to the world and saying, "Here I am, I'm interested." Obviously, we do things a little differently in terms of how we apply and how that leads itself into match. And I'm sure you guys have some questions about that. It is totally okay if you're on this call and you're thinking about applying to ortho in another specialty, or if you're just considering orthopedics, or even if you're want to hear about musculoskeletal, other types of career pathways to get there, we can talk about those too. But I know most of you are on here tonight because you kind of want to hear, well, what do I need to do to be successful at matching in ortho, and how do I, really make it a good experience for myself over the course of the next year? I want you guys to look carefully at the people that are on the screens around you. I know there are a couple people who said that they couldn't come tonight, but if there's anybody that you see missing here who is interested in orthopedics, I really appreciate some of the outreach of, John and Brian. I know both of you are interested, but somehow you weren't on a list because it was a sign up a while ago. So thank you for reaching out, Julia. Thanks for bringing them to my attention also. Al, thanks for bringing people to my attention as well. And so for those I don't know, I'm looking forward to getting to know you. And for those that, if there's anyone you don't see here that should be here, we're recording this so we can pass the link on and I can share it, with Julia or with Anna, and we can pass it on to everybody. Okay. But let's kind of dive right into it. Okay. For those of you who have spent some time in orthopedics already this year, I think that's great. For those that are going to spend time in the spring, I think that's great. But what is going to happen over the next several months is that you guys are going to start to plan your fourth year in medical school. And that's going to involve applying for away rotations in orthopedic surgery at other institutions. Everyone's aware of VSAS. Is VSAS something nobody's heard of on this call? Raise your hand with the emoji if you haven't heard of VSAS. Good. I get a peek at it every couple of years when I ask one of the students to log in and show me the application. It does change a little bit from year to year. The way that you guys find access to programs and who requires VSAS and who doesn't, those resources are a little bit hidden from me because I don't get that type of access, but I'm happy to field questions. I encourage you to talk with one another and to talk with some of the fourth years as well. If you have questions about how to find out if a program's in VSAS, how to apply to a program that's not in VSAS, have those questions come up at all? I don't see any shaking heads, so that's good. So why are we doing away rotations? What's the purpose of them, and when can they start? The answer is they can start as soon as you've met requirements for third year. But for the most part, traveling away will probably start sometime after July 1st, but that may not be true for every single place. Okay. As I understand it, Julie and I spoke about this the other day, and we were trying to figure, and Joe, we're trying to figure out when is the exact last day of your academic year. And it sounds like for some of you, it may be as early as late April, and for some people, it may not be until June 1st. But there is a transitional period between third year and fourth year. And generally, if you are planning to do a rotation, a sub-I, an externship that goes by lots of different names in orthopedics at Robert Wood, can you do it before July 1st? Yeah, you can. Okay. And in 2 years ago, 3 years ago, that wasn't the case. And with COVID, things were really weird. But the academic year used to transition at July 1st, and nobody did rotations before that. But we can certainly schedule you and work to what you need to do to accommodate your academic schedule. But the purpose of doing these away rotations is really threefold. One, it's to give you a great learning opportunity at a place other than here, to get exposure to how orthopedics gets done in other places. Okay. To maybe be exposed to a subspecialty that you haven't seen before in another rotation. Because if you do 3 or 4 rotations in anywhere from the spring of this year to the fall of this year, hopefully you'll get experiences in a lot of different aspects of orthopedics and see different things and see regional differences, residency culture differences, how programs differ in terms of size, in terms of the resources available, in terms of how residents are educated. Hopefully you'll see how a larger program has one impact on how you learn, and a smaller program may have another impact on how you learn. You may see how the presence or absence of fellows can really impact how much those residents learn. And, these are questions I think that as you think about your away rotations, you might want to try to experience different things at different places. The second goal of your away rotation is to see if a place is a good fit for you. And you may do an away rotation and realize that place wasn't for you. That actually happened to me 20 years ago. We didn't have the same resources. We didn't ask a lot of questions. I didn't really have any mentorship as far as how to pick them. That's kind of why I do what I do, because I want you guys to have some information. Away rotations are a way for you to get to know a program and see if that's a place you could see yourself working. Thirdly, it's also a great way for that program to see you, because 30 to 35% of matches within orthopedics come from places that you've rotated at. Okay. Those are just the statistics. They would much rather get to know you over a few weeks and know what your ethos is, know what your personality is, know how you fit within the context of their program, know that by putting you with the residents in their program who are assessing you also, because really they're the ones who really evaluate you. Okay, you get some evaluations from the faculty, but the residents are really who you need to connect with. And I'm sure you guys have kind of figured that out as you've gone through your clerkships this year. Okay, orthopedic rotations are going to be similar to that. Okay, we'll talk about how to be a successful medical student on away rotation during boot camp, which will be later on this year. We'll talk about that later. But the fact is that when a residency is ranking you to match with them, they want people who want to be there. They want people who are going to fit in well with their program. Okay. They're not looking for like one specific thing. You don't have to be something you're not in order to match in a program. Okay. But they're looking for a class that's cohesive and a good fit for what their educational mission is. Okay. And the away rotations give them a chance to evaluate you best, much better than they can, a one-day interview. Okay. And so they can definitely make you. It's possible they can break you, but you go and you perform well at a place, it's something that will really hold you in high regard in their institution. And they would much rather have you come as a known commodity who spent a month there with them already and proven your goodness of fit, as opposed to someone else who they met for one day on an interview. So the externship definitely gets weighed heavily. And so when you consider these three things, the chance to learn in a new environment, the chance to experience different types of programs so you can compare and contrast when you go and interview, And then the opportunity for you to evaluate them as a program and fit for you, and for them to evaluate you as a fit for their program. Those three things are why these away rotations are important. And it might seem to you that the choice of these can be a little overwhelming. Okay. It doesn't have to be. Okay. Um, it is, you don't want to waste your rotations, but you don't have to have this perfect list of selections. Okay. And one of the things that we are going to do with everybody is assign you a faculty advisor. There's 8 faculty within our department who volunteer to be faculty advisors. One of them just joined us, Dr. Cott. Hi, Brian. Um, and we're going to send out those assignments this evening. Okay. And what we want you to do over the course of the next week or two, okay, your faculty advisors know we're having this meeting tonight, is we want we want you to reach out to them and set up an opportunity to talk, whether it's in person, visiting in office hours, catching up after cases, doing a Zoom, just to kind of introduce yourselves, kind of talk about where you're at. There are only 2 to 3 of you per faculty member, so it lets us spend more time with you. Okay. If Dr. Cott and I try to advise all 16 of you, it's going to dilute your experience and dilute our experience. Okay. The best thing is to really have somebody who can shepherd you through this process. And each one of the faculty advisors have been doing this, for multiple years. And so it gives them some experience to draw from. Some of them are younger, where they recently went through, applying to residency and remember it. Some are old fogies like me, but I have been doing advising for a long time. And even though I'm out of touch with what programs are like, how to advise you and to bring you some of the current data about match, Dr. Gatt and myself, are plugged into the Council of Orthopedic Residency Directors through the AOA, and we get the data on match and on signaling and on all these different questions that you have. And we'll try to get that data to you in real time. We'll try to give you some reading about match. Some of you may have read articles already about it and have some questions about it. Okay. So when we assign these orthopedic advisors, one of the first things we want to start to do is start to talk about, hey, where might I do my away rotations? Okay. And, these decisions are not going to make or break you. Okay. Depending on some of the facets of your application, how much research you've done, what your third year grades have been, some of the more concrete and scalable, quantities that we can look at, we can help predict, what might be slightly more favorable for a match for you than not. Okay. But don't feel like this is a earth-shattering decision to make, but we're going to guide you through that. Okay. And it'll take a little while. You're going to apply through VSAS. You're going to get accepted at some rotations. You're going to get rejected at some rotations. Some are not going to respond. Some are going to respond super late. And it's a little bit of a rocky road, but what we're hoping is that we'll help to put in place, what are going to be, 2 or 3 solid away rotations for you. And then all of you will do a rotation at Robert Wood Johnson. If you weren't planning on it, you should. Okay. Number one, we know you. It's important that programs see documentation of a rotation at your home institution, the support of a letter or 2 or even 3 from your home institution. A chairperson's letter is usually important. So Dr. Gatt's prepared to write a letter for all of you. Okay. But really, he draws from feedback because he can't get to know each and every one of you, as much as he would want to write that letter. But he draws from the feedback of the faculty who advise you, from the residents who observe you day to day when you're working with them side by side, taking call on your home rotation. So most people do tend to favor doing a home rotation earlier in the year as opposed to later in the application cycle. Okay. But obviously, it would be hard to have all 14 of you on my grid right now, okay, on rotation in May, and then have you all go out on away rotations. And, it wouldn't be good for your experience. It wouldn't be good for us. Can we do it? Have we done it? Yeah. COVID year, we had 20 people on rotation for 8 weeks. We figured it out. We actually spread it out over 3 months instead of 2 months, but we figured out how to overlap everybody and make sure letters got in. That was a hard year. But we're back to normal now. You guys are doing away rotations. We did in-person interviews this year, and we think things have kind of gotten back to normal. What's new in all of this that you may have questions about is signaling. Does anybody know what signaling is? Have you read about it? So when you apply for residency next year, you're going to go through you're going to go through ERIS, right? The residency match program. Okay. And when you apply, you're going to have the opportunity to signal 30 programs. Ortho has more signaling options than any other specialty. Some have a few, some have 6 or 7. We're weird. Okay. It's because of how the numbers work out. This was worked out by a group in the Council of Orthopedic Residency Directors at the AOA. And this will be the third application cycle where the number of signals is 30. And most people think that's probably the right number. You may say that's not fair. What if I want to apply to more than 30 programs? But if a program's number 31 on your list, how serious are you about them? It's actually allowed us to be, um, far more accommodating and reading people's applications thoroughly and completely. It allows us, and with the step 1 score no longer part of the application, it frankly allows us to look deeper into your application and not have 800 applications and feel like we have to use a screening criterion of a board score in order to read the application. But if we get 200 signals, we can read all 200 applications, right? So for us as a small program, it's been meaningful. But for a place like NYU that gets 800 applications a year and gets 600 signals, okay, they're still going to find other criterion that are going to try to screen people out. And NYU only interviews about a third of people that rotate there because they get almost 150 rotators. Okay, so there's complicated things to talk about, around where you rotate and things like that. I'm not telling you not go to NYU, and we've actually been really successful matching people there, but it's the biggest program in the country, and some of the match characteristics there are a little bit of a mystery to me. But I know they really try to fairly assess your applications. But
hey, Tom, it's Brian. Quick question. Just our internal data. What have the number of applications been in the last 2 or 3 years? Have they started to go down with the signaling? And how many of the applications did we get were signaling applications?
Yeah, so I think that the actual number of applications, I think people started to see this year that signaling led to, a greater evaluation of your application. And traditionally, the number of total applications that we would receive, when people had unlimited numbers of programs they could apply to and no signaling, the number applying to our institution was in the neighborhood of about 500. Okay. To kind of give you statistics on that, there are about 840 spots nationally. Okay. And the number of applicants has been hovering in the neighborhood of about 1,100 to 1,200 U.S. grads. So the number of spots doesn't match up with the number of applicants, but there could be years where you would have, hundreds more applications than you could possibly review. And yes, with signaling, the number of applications that we got this year went down. I think it was only 300, and there were 230 signals, I think. And frankly, our way of dealing with that was to only read the applications that we signaled. Okay. That's how I understand it internally, Brian. Okay. I think it's a great question for you guys to know. When you apply, you're going to signal the places you really want to go. And those are the places you should expect to get interviews, with rare exception. A handful of people last year got interviews at places they didn't signal that they also applied to. But what the residency directors are intending with this process is that ultimately you're not applying to 70 programs hoping to, hit a match on 1/7 of them. It's that you're signaling 30 and you're hoping to hit a match on a third of them. Okay. Where you're interviewing. So, we still want you to be in a neighborhood of, 8 to 12 to 15 interviews. Okay. Ideally. And that still seems to be statistically the right number to match, but that seems to be going down. The number of interviews you have to match seems to have gone down with signaling in the last couple of years too, is what the data says. I'm going to share a presentation that I have here real quick and just kind of play through this. So having the 2023, I saw the 2023 match data from this spring. So these were our graduates from last year nationwide. The rate for U.S. seniors was 72% match rate, okay, which matches up with the number of programs, okay. The data that we have from papers published in the Yellow Journal, the Journal of the American Academy of Orthopedic Surgeons in 2018, showed that the mean step one score was about 244, and that the average number of research papers that an orthopedic applicant, had completed prior to completing medical school was 4. Okay, those are averages. And I can tell you from personal experience that we have had people match at our program with board scores as low as 210 on step one. And we have had students match successfully at programs with board scores as low as 209 at, what are considered by many to be top 10 programs. But we don't have step one board scores anymore. And I recognize the weight that step two carries with that. And we would probably be wrong not to jump into that, talking about that right away. I think all of you should probably plan on taking step two, because I think there's very few programs that don't require it. Taking step two early enough that that score is on a transcript and able to go out with your application in mid-September. So you should plan on studying for step two throughout this year. You should plan on studying for step two for a dedicated amount of time. I don't know what that magic number is. Most people think it's about 2 weeks, maybe 3 weeks. Most people allocate one block of their fourth year to studying and preparing for step two and taking it, and then move on and continue with their fourth year requirements and their orthopedic rotations. And so, not all of you are going to go into an ortho rotation in May or June, and maybe you take step two then. Maybe you do an ortho rotation, then take a month off, and then do step two, and then go back into an ortho rotation. But between June and probably late October, that's the block of time when you want to do your orthopedic rotations. Okay, that is when programs are going to be considering you. And if you're going to do an away rotation at a place, they're offering their interviews in mid-October. There's a universal day now for offers, which is not until November. Okay, roughly November 17th, I think it was last year. So that probably means that with that universal offer date, you can go as late as, early November with an away rotation, but that's probably late. You're not going to get a letter of recommendation from a faculty member there that could be relevant anywhere else. I'll get into letters of recommendation in a little bit. Okay. So as we think about planning these coming months, that's the timetable we're talking about. Okay. You are going to complete, I'll come back to this. I'll come back to this screen share in a second here. Okay, let's get everybody's smiling face back up here. We are going to, in the next couple of months, plan the next year. And we are going to plan a block of time in the late spring, summer, and fall of next year when you're going to complete a home rotation at Robert Wood, away rotations, take step two, but also be fulfilling your orthopedic requirements. Now, as far as planning the rest of your fourth year in your schedule, one thing to be aware of is that as you have to know when orthopedic interviews are. They're in December and January. Those are months you either want to schedule not at all or schedule lightly where you have a flexible rotation. Many have taken an ER rotation so that they can be here and do they can do, ER shifts, and then they can go away when they have to. Okay. We used to tell people to take the whole month of January off. Interviews this year were about 60% virtual and 40% in person. We tend to favor in person. We think it's important to meet people face to face. We interview a lot of people that don't rotate but are interested and signal us. And having a Zoom interview just doesn't give you that interview. We fought hard to get in-person interviews, but a lot of institutions keep costs down to improve the equity of people applying, because you don't want somebody who's, just can't afford to travel so much to be shut out of this interview process for any reason. You want everybody to have, an opportunity to go and interview. Many programs have opted to try to keep it to Zoom, which has made it a little easier to complete some of your clinical rotations later in the year. So just keep that in mind when you're thinking about how to schedule those blocks in December and January. And we're going to do lots of things with you guys over the course of this year. we're going to schedule, and Julia's going to help me figure it out with the rest of you, a boot camp that's going to be 2 days in person with some lectures. That will be like last year we did it at the end of May, right after Memorial Day. That's probably when we're going to do it this year. We'll make sure that it is a time that's amenable to all of you. I know when you look at that transitional week between third and fourth year, a lot of you may try to travel. You can do that. But the first 2 days we tend to do live in person, and the subsequent days we do virtual lectures with some of the core topics that you really need before you start your rotations. We'll get more information out to you about the boot camp. We have a couple scheduled meetings in the late summer and in the fall where we talk about submitting your applications. We will talk later about coaching and interviewing. Dr. Cott and I did some mock interviews with most of the students back in November, which we got a lot of great feedback on. I think that worked really well. Brian and I had fun doing that night. We did some virtual when people were away too. Brian did that. Credit to him. And then we also work with our students as they're planning to, a lot of us as advisors are going to sit down with our fourth years in the next couple of weeks and go over our rank list as you prepare to submit that for the final final go around before match. Okay. So there's a lot to figure out, and each one of you, has concerns and has, ideas of where you may or may not want to rotate. There is definitely some good general advice to discuss about that. But I want to pause here and give a chance to kind of open the floor for discussion and just see what questions you guys have about planning. Again, we're going to assign mentors to each of you and kind of who will walk you through this process and start figuring out some next steps. Okay. But any big questions right now? I am going to talk about research and taking time off. That's coming up in my next segment here. So don't worry about that. Questions?
Hello, Dr. McPartland.
Hey, Dr. McPartland.
Hey.
Go ahead, Adrian.
Thanks, Julia. Nice to meet you. My name's Adrian.
Nice to see you.
So I did have a question about the scheduling, the mentorship and the scheduling of fourth year, because it turns out the registrar is requiring us to fill out these forms no later than February 16th, and they have to be submitted by then in order to schedule and enter the lottery for our M4 schedules.
Okay.
And I just want our mentorship meetings would be feasible with that timeline, which is, I guess, now coming up pretty soon.
Yeah, it shouldn't be a problem at all. And honestly, Adrian, many times what happens, it seems like things are very concrete, and sometimes you need to have your mentor sign your schedule. But those things change. It's a new registrar in the last couple of years, and so I know that, with a new person, you kind of get new rules, but in my understanding, things have been fairly flexible before. So sometimes you have something that looks like a placeholder and all of a sudden you're changing it. But this was the purpose of having this meeting, to start thinking about it. And I think with the faculty to student ratio, talking to your faculty member for, an hour in the next 2 weeks is very feasible. So everyone will be prepared to help you with that, to get that in. And if for some reason you're stuck, come to me.
Awesome. Thank you so much.
Okay, sure. Julia.
Okay, yeah. Along the same lines, we're starting the lottery process for some of our blocks, like this weekend next. And I would imagine that most of us will probably have at least 3 months that we will not be scheduling any Robert Wood required courses or electives, because that's when we'll be planning to do aways.
Right.
And I was wondering if it happens that we get a bad lottery and get something scheduled during that time where we will have to be at aways, how do we handle requesting a switch or that be moved?
So Julia, you guys will have to keep me apprised of what that process is and how it's progressing. I think that generally, if they are trying to allocate things like sub-Is and other required rotations over the course of the fourth year, and they've changed how they intend to do that, we may have to adapt, on the go a little bit. there's enough time given the signaling process and an extra month built in June that even if you got a weird block in August that you had to do something else, you'd probably be fine. But unfortunately, the sacrifice that, all of you may make is that you may do things later in fourth year, even into March and April, where your classmates might not be doing that. And so that may be the trade-off, where in the latter half of your fourth year in the spring, you might be finishing up some required stuff because you took this time off to do the aways. It's one of the vagaries of, or vagaries rather of orthopedics that we made some sacrifices. When I was a student, I remember doing rotations into April, as an M4, and but I didn't mind it, and everyone understood that we were nearing graduation, but I was still anxious to learn. So if you run into real problems, certainly let us know. Okay. If you found yourself in a rotation during interview season where your colleagues who are going into other specialties are all done, and everyone's saying, well, why are you going on all these interviews? That we figure it out. But if you're in a bind, certainly letting the registrar know, because, I don't know the new registrar very well. Okay. And so helping them become familiar with what it's like to have a fourth year schedule for orthopedics is something that you probably need a little advocacy for. So I would definitely, Dean Meehan and Dean Lombach understand this. I have been talking to them about this for many, many years. And generally, they're pretty flexible in making changes. So if you run into trouble, let us know. Okay. Don't be afraid about the lottery, that it's going to totally screw up your schedule. Okay. This is important enough. They want you to match. They want you to be successful. They're trying to run a curriculum at the same time. Fourth year curriculums are a little bit all over the map. You got to get your requireds in. So we do the best we can. Okay.
Hi, Dr. McPartland. Do you know if in like past years, like an orthopedic sub-I has counted towards the sub-I requirement of like Robert Wood's fourth year schedule? Because as of right now, they've put like on the scheduling that we need to schedule a sub-I in one of the kind of core clerkship departments.
Yes.
You know,
So, Divya, this has been a point of controversy over the years, and it's a really good question. Um, I have personally been of a mind that a sub-I in medicine or peds probably serves you better than a sub-I in a surgical field to prepare you for the challenges you're going to take on as an intern and to take care of sick people next year, because you're going to do that. But I have been swayed a little bit as time has gone by. Dr. Gatt, who is ultimately the one who signs off on these things, has been swayed a little bit. And as we hear some of the difficulties like Julia just brought up with a schedule and needing to fit in a sub-I, if we started to see that it really was difficult for you guys to schedule appropriately to be successful in this process, then I think we would advocate hard for making ortho qualified as a sub-I. The problem is that the intention of a sub-I is that you are basically making decisions as the doctor. Okay, you are writing orders, your notes are being co-signed. You are actually the manager of the patient. And on the orthopedic service, there's never been a pathway to allow you to do that and be the person who's writing orders and entering. Whereas on peds and medicine and family, those have been real considerations. And for that reason, we've tried to keep the intention and the mission of the medical curriculum and making that sub-I a real practice run of being an intern next year. And so we don't want to deviate it from it much, but if we found that it was becoming untenable for you guys to have a schedule that was going to be successful for match because of these other requirements, then we might capitulate. But as of now, I would say no. It's not intended to be a sub-I. I will bring the question up with Dr. Gatt again, but as you guys are going through the lottery and figuring these things out, I do want to see, and it might take a random sampling of your schedules. I'm going to have your advisors look out for it and bring this question up to each of them, because they may find it challenging. Dr. Gatt and I are frankly more familiar than the other advisors are with what the requirements are through the medical school. Dr. Balicka, who went to medical school here, would also be familiar with it, but she's actually out of the rotation this year because she's having a baby next month. So, we kind of know how Robert Wood works and what's been important. So yes, I'm trying to be a kind of a purist about how the intention of that is, but I get your question. And I think we're open to it if it becomes a problem. Make sense?
Yeah, thanks. That stands to reason.
Yeah. Good. So let's talk about research real quick, okay? So I know a couple of you indicated answering a questionnaire back in the fall that you may intend to take a research year off. Is anyone already committed to a research year next year? John, are you? Yeah. Good. So Aman, you did. Anybody else?
On one
No.
right now.
You're on one right now, right?
Yeah, correct.
That's what I thought, John. So you're coming back into the application cycle from last year, okay? So
Yep.
Aman's already committed this year. But if anyone else is considering this, you're obviously starting to make some decisions, okay? This is the time of year where if you're going to commit to a research rotation, this is the time to be looking for those offers, accepting those offers. And if you are considering taking a year off to do research, it's worth reaching out and talking to the advisor. We'll assign to you right away. Since there are not a lot of you, if you're at a bind and you really need to talk about it right away, let me know and we can talk this week. Okay. But basically, research is a wonderful way for you to get better exposure to our field, to understand how scientific questions are asked, to enrich your experience on your rotations as you think about these questions. Okay. And I'm sure John can tell you that. Research rotations, generally, if you do a committed year away, you're going to get involved with a lot of projects. You're going to get a lot of publications. Do publications help your application? Of course they do. All right. Is there a magic number of publications that can make you match? No. Can you match with 0 publications? Of course you can. Okay. But it is another thing in your application that builds the strength of the application. Okay. If you're somebody who takes step 2 and your score is a little bit on the lower side, okay, and we can talk about those ranges a little bit, we will. Research is something that can bolster that application, okay? But many people who come across and think they have to do research because of what they've read or what they've been told, it is not always true, but it can really enrich your experience. Is it too late to get involved with a project within the department if you're not already? No, it's not. Okay. And definitely let us know. I know many of you already are. Okay. But taking a year off is a big decision, but it's not an absolutely necessary decision. Okay. It used to be a lot easier to decide this when we had the step 1 score as a kind of a continuous variable that we could kind of say, your application is on the stronger side because of where you are with your clinical grades and your board scores and your volunteer experiences so far. I don't think you need research. We don't have that now. And it's a little harder, but is it impossible if you took step 2 and suddenly realized, you know what, my score is not where I want to be? Can I change gears? The answer is still yes, but it's a little harder. Okay. So these decisions have gotten a little bit harder for us to make. But Aman, you've already decided, you've already committed. Awesome. That's great. Enjoy it. Where are you doing it?
So still figuring out on the specific location, but I've been working with my Anthem Mentions mentors of
Great.
where to do
Awesome.
it.
And Dimensions, they have amazing resources and, they set up programs that are really well prepared for you to come in and be successful when you get there. So I think that's awesome. But a lot of the questions that people ask, and this is the stuff people want to get into when we have this conversation. I'm not going to talk about any one person's application here is, realistically, what do I need to match, right? So there's not one magic recipe for matching. Okay. Obviously, the better you do in your clinical work, the better you do on step 2, the quality of some of the volunteer activities you do, the quality of some of the life experiences that you've lived and share. These are all important things. Okay. But on your away rotations, people don't know what your board scores are. People don't know what your research is. All they know is your character and how hard you work. And I can't emphasize enough how important that is. Someone whose board scores are not the best and whose grades are not all honors can still be the best resident in their whole residency. Okay. And being the indispensable person, or the person that everyone's like, hey, we had some great students rotate this year, okay? But that Karen McCarr, she was the best person that rotated with us. We want her, okay? When the residents all come back to the program director and say that, the program director looks and says, yeah, Karen's a good student, okay? She didn't blow the doors off, or maybe it did, Karen, okay? She didn't blow the doors off here, okay, with her grades, but she was the best person. We really liked her. They're gonna find a way to take you, okay? So how you do on your away rotations supersedes everything else at the end of the day. You could have 100 papers and, have, a 280 on your boards. Can you get a 280? I've seen the 274. That's the highest I've seen on step 2. But if you're a jerk to everybody when you rotate, guess what? That feedback goes back and you are not high on that rank list, no matter how strong you are academically. Okay. So who you are as a person that really matters the most. And I think that's what it should be, right? Yes, it should be merit-based, and there should definitely be, academic traits here that we're evaluating, but they're not everything. Okay. So you guys find yourself in a situation that feels precarious because no matter how many practice tests you take or how many shelf exams you do well on, you don't know exactly how you're going to do on step 2. It is not as hard as step 1. Okay. But the day you get your step 2 score back is going to be a momentous day. It's going to be. Okay. But there isn't one magic score that's going to make or break. If you get a 260 on your step 2, awesome. If you get a 240 on your step 2, awesome. If you get a 225 on your step 2, awesome. Okay. There are scales that are better. Okay. If your step 2 score is a 205, can you still match in orthopedics? You bet, but we're going to be more strategic about it. Okay. Historically, on step 1, we like to look at a score. Some programs would cut off looking at applications below 225 and some as high as 245. Okay. That was the range they fell in, but the mean was about 235. If you were at or above that, every program was looking at and reading your application and looking at all the other merits there. Okay. What is more important now is actually the quality of your third year grades. You're halfway through. Okay. But by now you understand what it means to be an effective and successful student on the rotation, to be engaged in learning all the time, to get good evaluations and feedback from everybody. And that the shelf exams are hard and you got to study for them, right? I remember the first shelf exam is always a shock, like, crap, that was hard. That's the bar that you have to kind of meet, right? And to get honors in a rotation, you kind of have to get honors on the shelf unless you really crush the rotation, right? And yes, there's clinical honors and then true honors and things like that. But at this stage of the game, you kind of know what you need to do well on your rotation. So continue to do well in your rotations. I know you all are. Okay. And there's no magic mix of high pass and honors and pass that you need. Okay. You don't have to honor surgery to get into orthopedics. Okay. Quite honestly, I've heard a lot of people say, you know what, I really like when I see my students honor psych or honor OB, okay, or honor family medicine when they're on a rotation that, they're not really in love with, and they're kind of bored, but they still bring their A game every single day. And those comments that the residents put in there and your faculty advisor puts in there, those are important, okay? So be good citizens, be students that work hard, be students that are part of the team and making the team better. Don't show up disinterested and bored, show active, interested learning. Don't disappear, from the service. Those words go without saying, and they're critical, when you go on your ortho rotations. You really want to stand out as the person that they have to take. Dare them not to take you because you were too good on the rotation. Okay. That's how you want to be in your orthopedic rotations, and try to bring that attitude every day here. Do well in third year because that stuff matters too. Okay. And I think that your community service that you do, okay, I think it's really important to underscore the things that you have done as people that have been meaningful and formational experiences for you. Okay. When you write a personal statement, we'll kind of get into how you write a good personal statement down the line, but what brought you to this moment? What are the things you've overcome that were real challenges to you as you have been, on this journey to bring you, here that make you who you are? There isn't this one this fake person out there that they're looking for. They're looking for you being you. Okay. Orthopedics, when you match in a program, it's a 5-year marriage. Okay. And if you're not genuine in who you are going into marriage, that marriage is going to fail. Okay. So just be you and show them how great you are. Okay. And you're going to do great. Okay. As step 2 scores come in and we start talking about them, it may be a moment of relief for some. It may be a moment of pause for others. Okay. But everybody has a degree of self-doubt. I know that you're listening to me say this and say, oh, these are the scores and these are scores. But all of you have this illusion that if I don't get a 265 on my boards, I'm not going to match here. Okay. Because that's the messaging that's out there, but it's not true. Okay. It's not true. Are there situations that can be impossible to match? Yeah, there can be. Okay. And unfortunately, when we look statistically at it, okay, it's possible that not everybody who's on this call will match. Okay. And that's a reality we'll deal with if we have to deal with it. Okay. But our goal is to try to make each of you the best applicant that we can, to understand where your strengths are. Okay. We can't hide the weaknesses. Okay. You can't bury those things. Okay. You wear them, and whatever they are, we'll deal with them. We'll figure out how to be strategic about where you do rotations. We'll figure out how to be strategic about, what you do when you interview. If interviewing something you're not good at, you're someone who's really humble and quiet on an interview, that's not how you want to be in that interview room. An interview day is different than every other day of your life, okay? Because you actually have to sell yourself, which I guarantee at least half of you are not comfortable doing that, but we'll coach you up so you feel a little bit better about it, okay? Because going and being quiet and quietly answering questions in an interview is not going to make you stand out. It's just going to put you in the pack, and it's okay to be in the pack. You're in a really strong pack, okay? But standing out is sometimes the thing that puts you slightly over the edge, a little higher in the rank list, and improves your chances of matching. So we'll talk a lot about that come the fall. Okay.
Tom, I'll let you take a breath. You're doing such a great job. I mean, it's a pleasure. I've heard a lot of this stuff, but hearing you say it, and you're so eloquent. So I'll let you take a breath, and I'll just say one thing, and hopefully you can, agree with me on this. The people on this call, you've gotten to this point. You're at a very competitive medical school. I've met a lot of you. You are the top candidates. I mean, unless there's a huge flaw, you are going to eventually match into orthopedic surgery if you really want to. This is not the type of thing that's the Olympics, right? And I know swimming, it's 2 people in the whole country get to go to the Olympics. Well, you're probably not going to go to the Olympics in swimming. But if you want this, and you have the help of Dr. McPartland and Dr. Gatt and myself, there's so many people behind you that we will find a path for you to get there. And unless it's, hey, look, the guy is, or female is such a jerk that nobody likes them, and your scores are really low, and you lied on your application. Well, you know what? Maybe we can't help you there. But, if you're reasonable and you're in the ballpark, it might not be the first year, but if you stick with it, you will become an orthopedic surgeon if you really want to. So don't think about this and say, I'm doomed and whatever. If you want it, it will happen. So just keep that in the back of your mind when you're going through all this stuff and having that self-doubt. I really believe that to be the case.
Yeah, and I think you're absolutely right, Brian. We want to help you get to your objectives, and we want to present you as the strongest applicant that you can be. And it's a competitive field. It is a hard match, okay? And it would be wrong of us not to say that and to understand it, okay? But each one of you is here because you have worked hard and persevered, okay? And we will find ways to make you the strongest applicant that you could be, so that next March we can all celebrate together. Okay? So let's pause there for a second. And Brian, thank you for that. I really appreciate that. I always hate that part, because it's hard, right? We know statistically what it is. But last year, we matched every primary applicant that we had from Robert Wood. And we even had somebody who hadn't matched the year before matched last year. 2-hour program, which was awesome. Okay. So, we are so happy about that. Thanks, Julia, for that. And so I always hate talking about that part, but we want to help you plan and be as prepared as you can be here. Okay. So I want to pause and take another little break here because now we've rolled out some of that area where your questions start to seep in. Some of them could be individual and they could be things you can say for your advisor. But what's on your mind right now, just as far as, hey, what does it take to do this? And hey, what does it take to do that? What are you worried about, guys?
I'll jump in here. Adrian again. I guess my main concern, especially given it's January and VLSO just started to open and programs are posting it. I'm my main struggle and decision right now is like trying to figure out how to decide and how to evaluate where I want to do my aways.
Yeah.
And I know you touched on this already, but that's kind of like where my head's at the moment, as far as like, how do I even decide what's a good choice or where I want to, try to go.
Right. So, Adrian, I'm going to pull up a whiteboard real quick, and we can kind of haven't used this before. I'm going to let everybody start a whiteboard if they want to. I haven't played with this. This is kind of a new feature. And how does it work? Do I share screen? Do you guys know? Oh, new whiteboard. There we go. Okay. Is it up? It's up. All right. So what are some factors that can go in deciding your ways? All right. So geography. We grew up in the Northeast. We're lucky because most orthopedic programs are in the Northeast. Okay. The most in the country. Okay. So of 185 programs, okay, that comprise those 850 spots that I talked about, some are MD and now the DO programs are also in the ACGME match. So it's increased the numbers. We've had a couple of residents that have chosen and ranked very highly DO programs, particularly here in New Jersey, Jersey City, and matched there. So it's expanded the number of programs available. Okay. Only minimally decreasing the number of DO matches that they've had because a lot of them do favor the DO students, but it's really helped. Okay. So geography can factor into that. Okay. Size of program. Okay. So many of you are familiar, and if you aren't already, you'll become so with our program, which is 3 residents per year. It's a small program. Okay. The smallest programs are 2. When you think about that, how does that impact a program in terms of the opportunities the residents have to be busy? How does it impact their call schedule? I mean, our residents take a lot of call here, but honestly, they think it's part of the learning experience, and that has to be baked in. Going to a place where I'm going to take call once a week, is probably not going to give you enough experience, right? Operating. Does this program have night float? 4 times a year, and that's how they make call work. And I'm missing out on 4 months a year for my first 2 years of residency. How do I feel about that? Okay, how do we compensate for that? So size of program can influence those things. Okay. Do I want a lot of research support where I'm going? If you're someone who wants to be doing a lot of research in residency, and it's okay if you're someone who just wants to do one project in residency that's required of you, okay, or 2 or 3, but not make it something that you take 4 months out of your residency to do research or a year off. There's a couple programs that still have a research year, okay? If that's important to you, great. But if it's important to you, but not to do a lot of it, that may also be a factor too, okay? How do fellows impact my education? Is it going to help to have a lot of fellows there? And does that mean there's more research support? Cool. If that's going to get in the way of my experience, Robert Wood, we've decided in many instances when fellows could even have been, a fellowship could have been started to not have fellows because it could impact the quality of the residents' education. Okay. Do I want to be in a program that's rural versus urban? Okay. Or suburban? Okay. And all the things that go along with that. Okay. How does that impact the type of lifestyle that I want? Okay. If you're going into a couples match, okay, and that's a decision maybe you haven't made yet, or maybe you have made already, how you pair with your partner's match, you may do better in the Northeast where there's a lot more urban density, and your match pairings, because when couples match, they put program pairings where you might actually rank one program and your partner's ranking another program and they're 30 miles apart or 50 miles apart, but that's an acceptable distance for you to live together, that may impact it. Okay. So those things can factor into it as well. Sometimes people really want to go into a particular subspecialty and they may say, wow, I know I want to do joint replacement surgery. And we all kind of hope you're not differentiated yet. Okay. But people who are really interested in spine might be like, I want to go to Jefferson because Anthony Vaccaro is there and it's a great place and they get the best fellowships and the best training during residency. That could affect you. Okay. It really could. Maybe most of you are like, who's Anthony Vaccaro? Okay. That's okay too. You know, all these things kind of factor into it. Okay. But there is definitely an element, okay, of match reachability. Okay. So someone who does have a 265 on their step two and has AOA, junior AOA, and has all honors, they are going to be somebody that in what is historically and academically rigorous and very selective residency program might be more competitive. So if you have an application that is not glowing with all of these accolades, you still have a great application, okay? And who cares if HSS is not going to read your application, okay? The fact is that you can match at what is historically a very competitive program with an application that is strong, okay? It doesn't have to be what you think of as this ideal application in order to match at Pitt, okay? And I bring that up specifically because more than a decade ago, we had a medical student whose step one score was under 215 and matched at Pitt and was one of their best residents. And that was a testament to that person who worked their tail off and did a year of research, okay, but was really successful, okay? So the academic rigor and reputation of a program factors into it too, okay? So if you have an application that is, you know, that has all honors in your third years, okay, and it follows it up with a good step two score, you would be probably fairly safe doing all of your away rotations at programs that historically match people who have some of the higher and more competitive applications coming across their desk, okay? But that doesn't mean that if your application isn't a 275 with all honors in junior AOA, that you shouldn't do one away rotation at one of those places because you could be the very best medical student they've ever seen and they're going to love you and you're going to match there, okay? You don't want to miss the opportunity to use your away rotations to show your skills and show who you are as a human being and your character at places that you might have a stronger chance of matching at. And so you have to consider that and balance it when you pick out these rotations, okay? But it doesn't mean that you shouldn't be reaching above your head, okay? There's really, unfortunately, no such thing as an orthopedic safety school, okay? But I think you all should have confidence in who you are and what you're going to do in your away rotations, that you're going to be someone who stands out at your away rotations. And frankly, our students have been standouts. We think we've been preparing them well for away rotations when they go away. Okay, that's the feedback that we get. So, and the feedback we get from our own students when they've gone away and performed and then thought about it even later on. So I think that when you pick these places, a lot of these things are going to factor in, okay? But one of the things that you probably don't want to do is reach way above your head if your application is not kind of at that highest level, okay? But I can certainly, give you examples, where that's been the most successful thing for somebody, okay? So this is the discussion that you have to have with your advisor, and they're going to have to know what your current grades are, okay? I actually think that it can be helpful to talk about other standardized tests you've taken before. The SAT is actually one of the best predictors of how you might do on step two, just because it shows how you take tests. Okay, I'm sure you all did well in the SAT, so you should feel good. You have to study, you have to put the time in. Okay, so selecting these programs also means learning a little bit about them. Okay, and figuring out, well, why would I want to go to this one over this one in this city? And so that takes research. And I can't help you with that part completely, nor can any of the advisors. You kind of have to do your homework and go on the resources that students use. Okay. I know OrthoGate is a place where people have gone for resources. It still exists. Everyone affirms for me every year that it still exists and is a common place to discuss things. Okay. But there's a lot of places you can go and read about programs. You can go to their website. Programs want to tell you who they are so you can see if you line up well with them. Okay. It behooves them to actually wear their identity on their sleeve so that they get people who are interested in their program. If you're not honest with who you are, you can't get people who are going to fit in your place, right? And so that's where you do some research. So that's my kind of long-winded answer to your question, Adrian. But I think it's really valuable to spend time going through that for everybody's sake. Okay, Brian, would you add anything to that?
Tom, can I jump in? Yeah, let me jump in for 1 second. I think that's absolutely accurate. And I'm just trying, as you were saying it, I was thinking what else on the margin could make a difference.
Right.
And I can't stress enough the personal connections. And what will help you here is we've created this database of the residents, at least for the last 15 years, where they've gone. So if there are places that have taken a lot of Robert Wood students in the past, and I'm sure they've done a good job, well, the program director and some of these attendings know that. And they say, oh, yeah, so-and-so went through here and so-and-so went through here and so-and-so's here now. They were all stellar. They may look at you a little bit different than if you're going to a place that we've never sent somebody before. Right. And even before you go, if you can make contact with a resident that's currently there, that can be huge because you step in on the first day and there are 8 people rotating. Oh, you've already talked to person X. They know you're from Robert Wood. They know you're coming up. And guess what? Somebody's going to help you out. And then the break's going to go your way, more often than not. So this is why we kind of pay it forward. You're going to go to your program and do a great job. But wouldn't it be the coolest thing if one of these third-year students called you and say, hey, tell me about your program. I'm really interested in it. I mean, everybody's, most people are happy with the residency experience. I think that would be the coolest thing. And guess what? You decide to come up there. Well, I'm going to make damn sure that you have a great time, because I'm representing the program I'm at now. So making these connections with former students that are currently with these programs make a difference. The other thing is some of our attendings, Dr. McPartland has connections with certain programs. He's been on AAOS committees with some of the top people in different programs. But it's not all the programs. So if you're real, and that's why it helps to talk to your mentor and say, oh, well, so-and-so knows somebody here and he's in a decision-making capacity, because all those little things can move you up a couple places. So having a conversation, of some of these people that might be influencers can help you direct where you want to go. Okay, we want to go to Baltimore. We have a connection with Johns Hopkins. Tom and I were just on the phone with them. We're starting a collaborative project, and someone was on the phone from the University of Minnesota. So you have an interest in going there, we can send an email beforehand saying, hey, look, we have a top student that wants to come down. Now, if you tell me you want me to send 10 emails all over the place and start calling people, I'm going to be like, that's a little crazy. I can't do that because my reputation matters a little bit too. But there are certain places that we have done very well with students, and you should look at that beforehand when you make your list.
Yeah, Brian's exactly right. And if you have a personal connection with someone that's connected to orthopedics at a particular place, that is something that you should think about. Okay. This is definitely a merit-based place, and there's not really a role for nepotism or any other type of non-merit-based approach. But knowing somebody personally there not only helps you when you go, but that's someone who can advocate for you within it. These decisions are not made by one person. Deciding to where to put you on a rank list is a group decision based on the observations of many people, not the least of which is the residents themselves. Okay, how you behave with them, how you interact with them day to day, what you're like when you take call factors heavily in how you do in your rotations. And then we'll talk about that before you go away. But the personal connection makes a huge difference. And like Brian said, we've been really successful at many residency programs. We've had a run of people going to Harvard, and they've done really well there. They love our residents. That's the feedback I get from Boston Children's, the feedback I get from Mass General, the feedback I get from Brigham and Women's. You know, our students have done well where they've gone. They've represented us well, and that blazes a good trail for you. We expect the same for you. You're going to be good ambassadors for us when you go out there. But we've done well at programs. So there's definitely places that we can say, hey, we know that we're going to match 2 people here, or we're going to know, you know, if we have 14 people in a class, that we're going to match someone here, we're going to match someone here, we're going to match someone there. There's probably, you know, 10 programs that we will reliably have people in, 5 to 6 of them, you know, in a given year. And so Robert Wood, of course, being included. You know, the chance that one of you matches at Robert Wood, you know, next year is probably 100%. Okay. The chances that more than one of you match at Robert Wood is probably in the 30%. Our intern class is only Robert Wood students. Okay, that's never happened before, but it happened. Okay, so the connections are really important. So thanks for that, Brian. So I think you asked a great question, Adrian, and I definitely wanted to touch base with that tonight. But this is really a good discussion with your mentors to go over, you know, what your application is, what your grades are, and really to help you decide, you know, where am I ranking in this competitive, you know, kind of milieu, and you know, should I be selecting, you know, programs that, you know, are, you know, a little bit more rigorous, a little less rigorous, and that's an important thing. I think that's exactly what you're getting at, but we'll help you sort through that. Okay.
Awesome. Thank you both so much.
I just shared the link for that whiteboard, guys. So I'm gonna close out the share, but you guys can refer back to that, and that'll show up in the recording too. But hey, Nick, welcome. You made it.
Hi, how are you?
Good. Where are you now?
I just finished OB&M on my EM rotation.
Okay, good, very good. We recorded everything before now. We got some good questions, so I will get you the link and you can go back and watch it. Okay.
Thanks a lot, appreciate it.
Dr. McFarland, on the topic of aways, Al and I sometime soon will be sending out a Google Doc for anyone who's planning on doing aways to kind of put their preferences and ideal time slots so that we hopefully don't overlap with each other.
Yeah, and
That'll
to get
come in
back
the
to
next week or so.
to get back to Adrian's point, okay, there is a certain degree when you have, you know, 15 of us here that are going to be applying, Amon, you're going to be in the 20, you know, the 26 mix. So, it'll be a different crew, but you need to hear all this information now because you want to hit the ground running when you come back next year. And you should be at this meeting next year when we do it in January, and we'll have you on there. Okay. Just like John's getting ready to come back in now. But to that point, if all 15 of you do a rotation at the same place that can only take 4 people, it's not helping everybody. Okay. And we don't run into a lot of problems with this. We tend to, probably the place we run into the most trouble is that we have like 8 people on a rotate at NYU, knowing that only a third of them actually get interviews. And it just seems like trouble. But I don't want to discourage anyone who wants to rotate at NYU or has a connection there to not rotate there. Okay. We've done well. We sometimes matched more than one student there. Okay. But I think that, you know, when you sign up for your ways, it probably is important to balance it out so that we try to keep the number of our students that are going to any one place, you know, at 4 or below, ideally. But listen, if it's the place you want to go, it's okay if each of you compete against one another a little bit. I guarantee if you can each see each other's signaling list, which you never will and we never will, okay, that there's a massive amount of overlap. And programs will compare you to your classmates, okay? But at the end of the day, this is your application. This is what you want to do, and you have the right to do it however you want to do it. But when we're scheduling aways, we do want to try to see what everybody's doing and share that information. And we're not going to try to exclude everybody, but it does help to see where other people are going. And if you're the last one to sign up and you're the 7th person on a list for a place, it doesn't mean they'll go there, but it just means in general, that pool is a little bit more diluted for each of you. Okay. And there's not one perfect place to rotate that guarantees a match. Okay. Or that you have to go to get this right. Okay. Because there are lots of different programs that can substitute in for another program, especially when you consider the Northeast and how similar, you know, Robert Wood is very similar to Lenox Hill, is very similar to UConn, is very similar to I think personally to University of Vermont, okay, to BU, okay, but BU also has a high profile research program with Paul Tornetta running it, okay. So there's lots of similarities and things you can plug and play with to try to avoid having you all crowd in one space. So that Google Doc is important. Try to fill it out, and you're not going to know until you start hearing acceptances from these places where you're actually going to. But you can also kind of lobby back and apply a little bit later to places if you need to. Okay, it's not an all or none hypothesis here. And if you contacted a program as a one-off, and especially a smaller program that doesn't get a lot of rotators and has to rotate later, you might get a positive feedback there too. Okay. It is possible to do more than 3 away rotations if your schedule favors it and you feel like it's going to help the strength of your application. Talk about that with your advisor as well. Okay. You guys brought up a lot of good concerns. I think I covered a lot of what we wanted to cover tonight. I know we're past an hour already. This always runs longer than it's supposed to. I don't mind, but anybody who needs to go, I want to respect everybody's time. There's, of course, a recording that you can look at. But this winds up being, something that is really important to kind of get started thinking about it. I don't think that anything that I said to you tonight is a big surprise, but it's important to kind of hear it in, a very factual and deliberate way to cover, what you guys need to hear about the match next year. Okay. I think that, I love looking here and seeing, I'm going to use the word diversity. I know it gets way overplayed, but the diversity of applicants that we have here. Okay. We need more women in orthopedics. We need more underrepresented minorities in orthopedics. We need people who represent, the population that we're taking care of here. Okay. And I would tell you that programs are very interested, okay, at this point in time in helping to diversify orthopedics. Okay. And so I think that there are programs available to help encourage more participation in away rotations and to garner interest in programs that are trying to recruit people from diverse backgrounds into their programs. And so I think that you should, look into those programs. I tend to have these discussions fairly individually, but I see such diversity as I look out. It makes me so happy that I'm just saying that there are programs that are out there that are meant to kind of, help get you more involved in things. Okay. There for all the women on the call. I'd love to see this many women on the call. This is awesome. Okay. I count 6. You all should be looking into the Ruth Jackson, Orthopedic Society. Okay. I know some of you are members. We've talked about it before. I'm proud that, you have put together some women in orthopedics forums through the orthopedic interest group. Okay. I know we have had forums for underrepresented minorities in orthopedics. I am a member of Pride Ortho. Okay. I'm a cis het, man, but there's a Pride Ortho group because I needed to walk the walk and be an advocate for people. So, there is, movement in that area as well, which Ortho was really stubborn on for a long time. Thank God it's moving forward. Okay. So I think that it's important to understand that, each of you comes from a different background and that, you have an opportunity to, there's opportunities for everybody and that we want to help you have the best experience you can and learn a lot of orthopedics and have fun. Because at the end of the day, that's what this is all about, right? Is getting you exposure to the field that you have proclaimed your interest in. And so we really look forward to having you on the rotation. As a third year, I always tell the students, we're not grading you on, your knowledge yet. We'll do that when you're a fourth year. Okay. We're grading you on your enthusiasm. So show up, have fun, learn, absorb. Okay. And then as a fourth year, yeah, we're going to challenge you a little bit. Okay. And we want to, in a lot of ways, we have to kind of figure out, all right, where do we want to teach more? Where do we want, how do we bolster everybody's strengths? You have to do that by challenging a little bit. But we're really looking forward to having each and every one of you kind of come through and be part of the team. We'll kick it all off together in boot camp in June, and we'll pick a date and get that information out for that week for you soon. But there's going to be a lot more to come. Okay, we'll do another talk in another 6 weeks or so and see where we're at with applications. Okay. Anybody have any other questions before we go that you think would be beneficial for the group? Brian, thanks for joining us tonight. I think it's really helpful. I know you've heard me do this a lot. I think you always do an awesome job of reminding me the things that I wish I'd said. And I think we do a good job with this as a team, man. Thanks.
Absolutely. Glad to be here.
All right. So guys, I'll send out the list of I'm going to send out the list of our advisors. But one thing I like to do is everybody's got their camera on. Divya, can you get a little closer? And Dan and Anisha, can you get a little closer just so I can see everybody's face? Al's got a well, Al, you can do your portrait, man, because you got your mask on. I just want a nice smiling face of everybody, so that I actually like to send out a board to everybody when you're rotating through of the students who are on our service right now. Okay, so John, I know you won't. I know you'll be back in July. Sit a little closer too. I'm just going to take a snapshot with the screen capture software of this screen. Okay, and I'm going to highlight everybody's name back on the screen before we do it. I'm going to capture one, and then let me get names back up there. Oh, they pop off. How am I going to do this so they don't pop off? I'm going to capture window with the names on because I really wanted to capture options, capture selected window. I got to get your names back up one more time because I like to send this out to everybody with a grid. Everybody keep smiling. Is there an easier way for me to do this? Can you guys think of any other tools that would let me take a picture?
I can take a screenshot of the group. We also have headshots like with actually maybe not everyone's on it. I could just take a screenshot if it's easier.
Can you do it with everybody's name on, Julia?
Yeah, it should work. Let me try.
Okay. Nick's got his hair all good. Nice, man.
Okay, everybody smile. Okay.
Awesome.
It did not include people's names.
I know that's the problem is when you do it. So I'm going to try one more time. Okay. And I'm going to kind of cheat a little bit. So I'm actually going to capture it as a video.
I think you can also use the snip tool and just include everyone's name.
That's true. That's exactly right. I got it. I put a timer on. I put a timer on it and it did it. So hold on, I'm gonna do it one more time so everyone can smile so we're not all looking around. You guys, hold on 1 second. Keep smiling. You all look great. Keep smiling. All right, I got it. Sweet. Okay. I am going to save that proudly. And I don't want to lose it. Hold on. There we go. I'm going to add it to my photos. I got it. Okay, good. I got to add shots for the board. And then I'll, if you guys can think of anybody else, is there anybody before we part that's not here that you think should be here? I wasn't sure, but you guys know best. I'm still going to follow up with Dr. Lombach and Meehan and see if anyone else they can think of. But if someone else comes along and is like interested in ortho, please send them my way and we'll get it sorted out for them. Okay. Pleasure to see you all. I know many of you, those I met tonight. Very nice to meet you. John, looking forward to getting you back in the team here on campus. I think that we're going to kick off a great year for everybody. Okay. Thanks, guys.
Thanks, Dr. McCarron.
Thanks,
Have a
Dr.
great
Thanks, Dr. Parland.
Talk soon. All right. See you guys.
Yeah.